Hi everyone, welcome to this month's blog on genitourinary imaging. I'm Dr. Matthew and I'm a body MRI fellow at Stanford University. In this month's blog, we are briefly going to describe some of the new articles that have come out related to GU imaging. First, I would like to thank the senior editors for their great help. The first article was a prospective study where the author sought to histologically validate the use of a fluorine-labeled PSMA PET agent called PYL to detect prostate cancer recurrence in patients with rising PSA levels. The PSMA PET tracer agent performed better in pelvic lymph node detection than multiparametric MRI. The authors show that the PSMA PET tracer, in conjunction with multiparametric MRI, improves the positive predictive value for the detection of histopathologically confirmed prostate cancer by 38%. The next study is a single-center retrospective study conducted evaluating intermediate and long-term outcomes of 307 patients with T1 renal cell carcinoma who have had treatment with either CT or MR-guided cryoablation. They evaluated overall survival, disease-free survival, local progression-free survival, and disease-specific survival at 3, 5, 10, and 15 years respectively. They showed no significant difference in survival between CT and MR-guided cryotherapy, with both percutaneous methods showing similar excellent survival outcomes. The next study was a single-center retrospective study using multiphase MRI to evaluate 59 renal cysts with both the 2019 and original versions of the Bosniak criteria. Two abdominal radiologists evaluated the lesions independently with moderate inter-reader agreement of a kappa of 0.57 for the original version and 0.55 for the 2019 version. The results showed that the 2019 version of the Bosniak criteria is more sensitive and specific for the evaluation of renal cystic lesions with MRI. The next study was a single-center prospective study involving 23 patients with biopsy-proven prostate cancer who underwent multiparametric MRI with and without an endorectal coil. The images were evaluated by two radiologists independently who determined no significant difference in image quality. The group concluded that multiparametric MRI with or without endorectal coil had comparable accuracy for Gleason score 3+4 or greater tumors, while multiparametric MRI with endorectal coil was superior at lesion detection. The next study was a single-center retrospective study of 62 patients with asymmetric renal disease with the intent to develop a method to estimate single-kidney GFR. These single-kidney GFRs generated from each phase of contrast-enhanced CT were compared to Gates GFR calculated using renal scintigraphy. The authors showed that the nephrographic phase correlates best with the smallest maximum deviation of plus or minus 36.9% from Gates GFR. In the next study, the authors performed a systematic review to determine the diagnostic performance of MRI in the identification of lipid-poor AMLs. Articles with more than 10 patients undergoing diagnostic evaluation with MRI with proven histopathologic findings consistent with lipid-poor AMLs were included in the study. 2,196 patients were evaluated from 23 studies. The pooled sensitivity was 83%, specificity 90%, and the AUC was 0.93. The authors showed that MRI is promising for the detection of lipid-poor AMLs and serves as a potential replacement for biopsy. In this next study, the authors developed a mathematical model using multiphase CT in order to calculate single kidney renal function. The group prospectively recruited 97 patients and used their model to calculate GFR. These calculations of GFR were compared to dynamic renal scintigraphy. Renal function calculated from CT and scintigraphy results were found to be similar, with a correlation coefficient of 0.945. Suggesting that this is a feasible and efficacious method to estimate renal function. In the next study, the authors sought to use new approaches to DWI for the detection of prostate cancer. DWI sequences were obtained by single-shot EPI, parallel transmit EPI, and readout segmented multi-shot EPI. DWI sequences were obtained with b-values ranging from 0 to 1500. Single-shot EPI showed higher SNR for B1000 and B1500 images, while CNR was higher on readout segmented multi-shot EPI. The maximum magnitude of ADC reduction for biopsy-proven prostate cancer was on readout segmented multi-shot EPI. Thank you again for tuning in, and please read our blog for further details.